You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial rejuvenation. With us we have board-certified plastic surgeon, Dr. Ahmadi. Dr. Ahmadi, welcome to the program.
Thank you for having me, Randy.
Always a pleasure to have you on the show.
It's good to be here back.
We've had you here on a couple of topics.
That's right.
Now, before we get into today's topic, for those that don't know you, tell us a little bit about your practice.
Well, as you said, I'm a board-certified plastic surgeon. And recently we have moved to our new office. It's a
huge place.
That's right. We have our own operating room, recovery room, and it's been a blessing for us. We're very excited about it.
I understand it's state certified. What does that mean?
Well, we're basically an ambulatory surgery center, meaning that the state oversees us, so we are a little more stringent about the qualifications and ruling.
Every time you're on the show, we talk. I mean, you're big on safety.
Correct. That is an integral part of doing any sort of a plastic surgery nowadays, as you know, with the news media, etc. It's been a hot topic nowadays, and we want to make sure that we deliver safe procedure to our patients.
So moving on to today's topic, facelift. I mean, what's changed over the last 20 years?
Probably we are less aggressive with our knives, and we have incorporated more technology, such as fillers, Botox, and laser.
So you do all of that?
Correct, and
okay.
By integrating all those concepts, you can deliver a more natural look and less of the lifted wind tunnel look that you have seen in the books and magazines of the Hollywood actresses, etc., from the 60s.
Yeah, now you say you attract somebody that wants a natural
Correct.
look.
The whole idea is to make sure that the patient gets what they want, but at the same time, they're not overdone. You have seen the overdone looks, and it's hard to correct them once they have been done so. It's best to approach it in a very calm, artistic fashion rather than a very surgical and steel-like fashion.
So this is, I mean, how much art, how much science?
I think
in the facelift or any type of
yes.
procedure like this.
It's a blend. You need to have some artistic talent to become a plastic surgeon, especially for the face. But there's also science to it. There are proportions, there are lines, there are angles that you need to follow. Even though there are some textbook measurements, etc., at the end, you cannot apply millimeters and centimeters to everybody's face and expect the result to come natural. Because at the end of the case, you look at what you have done and you may adjust it. And those adjustments may not necessarily be measurements that you were taught, whatever looks natural for the patient. So
what are the age ranges of the women? Are they getting younger and younger, older and older?
Well, there is the concept of facial rejuvenation is beautiful, meaning that it applies to all sorts of ages. If you take an aging face, probably starts in the mid-30s by lines around the mouth, the neck's dropping, becoming less of an angled neck, and then moving up the face to more tired look around the eyes and more lines around the eye lines, etc., to the point that the entire face looks tired, the nose plunging down.
Is that what they
eyebrows.
tell you? I mean, on a consult. I mean, what are the complaints? I mean, what do you hear?
Well, everybody has a different complaint, but for the most part, they complain about looking tired. They're tired of looking in the mirror and seeing the lines or the folds around the mouth or the neck that is not tight anymore. And what I commonly see is they walk into the office with pictures of themselves from 10, 20, 30 years younger, and they tell me, please make me something like what I was before.
And is that possible? I mean, to turn back 10 years, 15 years?
It is, but it has to be approached naturally, obviously. Let me give you a very extreme example. We have seen, obviously, ladies, even on on TV, etc., and I don't want to name a whole lot of celebrities, that they get these extreme procedures. Now, when they age, since the procedures were done in such an extreme, the body is not in harmony, the face is not in harmony with the body. So here you have a very, very, very young looking on a very, very aged body. So harmonious aging is another thing that we need to achieve.
So you don't want it too perfect? I mean, is that what you're...
Correct. Perfection is not the answer. You cannot take the face and make it perfect while the rest of the body has not been worked on. So it has to be harmonious. It has to be done very intelligently. Natural looks should apply to the entire body, not necessarily just the face.
Now, the younger patients
yes.
that are getting facelifts, I mean, in their 40s, you're saying?
Well, let's not call it a facelift, let's call it facial rejuvenation. And just to give you an example, what a bad facelift done at an inappropriate time can do to you. Let's take a 14-year-old lady, 14-year-old girl, and let's do a facelift on her. What do you imagine she's going to look like?
I guess very strange.
Very strange, correct. So when you apply a very tight pull, what you call facelift, to somebody who's not a candidate for it, they're going to look absolutely strange. Now that's an extreme example.
Okay.
That's a very extreme example.
A 14-year-old, yeah, that looks
correct.
strange. Okay.
At the same time, you don't want to look a much older lady to look 30 years old, and that's a flip example of it. So it goes both ways. And in the middle, these two have to meet. Meaning natural looking, when you walk up to somebody, they know they have had something done, but they can't pinpoint it. They can't see the scars.
And I told you, I said, I feel like I can spot a good facelift, 20 yards away. And you said not one of mine.
If you can spot it from 20 yards away, then that's a bad facelift.
Okay, because I feel like I have an eye for it nowadays.
You probably have seen enough, correct.
Yours.
You've been in this business long enough to pinpoint these things, but if you can spot a facelift from 20 yards away, that's a bad facelift at this point.
Okay.
Because by the time you get to about a few yards, you know that you can see the scars, they've been pulled too tight, the corners of the mouth are going towards the ears, and the eyes, they can barely blink.
Right. Now, do you think that the most people think that all surgeons are doing facelifts the same way? Are they, or are there big differences?
There are differences and variations in technique, and not every single technique applies to the same patient. You cannot do the same technique over and over and expect to get good results for different patients. Everybody is different. What makes a good surgeon is one who can take a look at a patient, listen to them, see what they want, and get there in the simplest and the safest way, and have enough of an experience and knowledge to vary the technique during the procedure to achieve an optimal result.
Now, they say artists can see the end result before doing it. I mean, when you see it, do you say, boy, they'd be perfect?
You need to have a vision. Even during the consult, while they're talking to me, I can see them after the facelift.
You can. You really can in your eye.
If you have done enough faces, and you should be able to envision them. Okay, what's going to happen? The lines are going to go away, the corners of the mouth are going to be softer, etc. I'm going to make the neck tighter. Yes, I can see this patient coming in a few weeks and smiling and thanking me.
Okay, so can a 40-year-old look 30? I mean, do you ever hear that? I realize it's tough to put an age on something, but do you hear that?
Yes, of course. But then again, that 40-year-old may be a candidate for a facelift if she was she had not been taking care of her skin, and she may need some surgery. But more than likely, that 40-year-old can be corrected and rejuvenated with minimal non-surgical stuff such as Botox or fillers, to plumb up the face, because she has not gone through the aging process completely. It's not volume loss that we're looking at. We're just thinking about shifting the volumes around, upward.
Okay.
And the concept of vectors, I'm sure that we'll talk about, really apply in
Vectors what?
Vectors.
Like the direction of pull when you're doing a...
That's a simple way of putting it. And basically, in the past, there was only one direction of the pull. You're going to pull everything from the corner of the mouth towards the ears.
So just pull everything back?
Pull everything
back.
In
the old days. And that was the training?
That was the training. But now it seems that every portion of the face has its own vector, meaning that the neck needs to go towards the back. And as you go further up the face, the vectors turn more towards the middle. So what was done previously, where everything went in one direction, has been changed to what we call a multi-vector facelift, where every part of the face gets pulled in different directions.
For a natural?
For a natural, to achieve a natural look.
Interesting.
Yes.
Now, I guess some people are doing more of a skin pull, then there's, the muscles underneath.
Well, as I mentioned earlier, not every procedure is not good for every single person. While, let's say, a 40-year-old, 45-year-old lady may be a candidate for just a skin pull, a 50 or 60-year-old lady may require some sort of muscle, skin, and skin resurfacing to make her look younger and give her that rejuvenated look.